Hello there, my name is Grayman, and in today's video I'm going to support, share and stand beside doctors, nurses and medical staff around the globe, in Asia, in Europe, North America, in Africa, all over the world. People are suffering now because of COVID-19. We all come together, support one another in order to be able to go through this situation. So today I'm going to look at some vocabulary that are important for the English learners. So if we look at the COVID-19, that's the name of the virus that caused the disease called coronavirus. Coronavirus is caused by COVID-19. We've all been following what is happening around the world. First, it hit China and then came to some countries in the Middle East, then Europe, and then moved to North America. Almost all over the world has been hit. It's been said 2/3 of the countries in the world have been hit by this virus. And it differs from one place to another place. So let's look at this. Disease. When any person has disease, that means he's not well. And that means he's ill or sick. So if you get virus, germ, or such kind of things, then you would be not well, you will be sick. The illness or the sickness that you get could be contagious or infectious. So what is contagious? Contagious means infectious. That means the disease would be spread. It could be from one person to another. Could be from animal to human being. That's zoonotic. But here, contagious means infectious. When a person is infected, when the person gets the disease, then he's been infected. Now he is not well, he is sick, or he is ill. The disease could be contagious, infectious, or could be just there in that person. It doesn't go to other people. So if you're diabetic, that would be your own disease. It doesn't go to others. But if you have coronavirus, that could be spread from one person to another, that is contagious. There's words that we've been seeing in the media. There is epidemic. So what is epidemic? Epidemic, when the disease is spread in a certain and one particular geographical area. So the outbreak of the disease is confined in one particular geographical area. We call it epidemic. For example, if a disease would take place in, let's say, Vietnam. Okay, I don't wish that to happen in Vietnam or any other place, but I'm just giving an example. In Vietnam, only in Vietnam, it doesn't go anywhere else. So we call that epidemic. Because the outbreak, the spread of the disease in that particular geographical area. But if it becomes globally, like coronavirus, started in China, moves to Middle East, then to Europe, then in North America, South America. As I said earlier, almost 2/3 of the world is being hit by coronavirus. So that is pandemic. Okay, pandemic. Most importantly, we have an organization that comes, people might not know about it, WHO, World Health Organization. This is one of the main organizations of the United Nations. It's called World Health Organization. Okay, now it's been so active, it's trying to help countries trying to confine the disease in one area. So when we talk about coronavirus, so we have some symptoms. What is the meaning of symptoms? Symptoms, the signs, things that you would feel or things that would appear on you. The symptoms could be fever. So what is fever? Fever, when your temperature becomes higher. The normal temperature to all human beings is 36, 36.1, 36.2, 36.3. Yesterday I checked my temperature. It was 36.4, and that was normal. But if it exceeded 36, it becomes 37, 38, then you have high temperature. That's what we call fever. So if you feel you have fever, or if you're coughing, and previously I had one small video, I talked about the same topic, but here I'm giving you more details. So to cough, that's coughing. So when you're coughing and you have fever, and then you sneeze, you know what a sneeze is? When you go, so that's a sneezing. So if you have any of these, plus these, you have difficulty breathing, to have a breath, and then this breathe. Breathe with E is to breathe, this is the verb. But this breath, this is the noun. There is difference in the spelling and difference in the pronunciation. To breathe, and this one, breath. So when you have difficulty in breathing, then difficulty in breathing, coughing, sneezing, fever. So what's happening? So your respiratory system, starting from here, the nose, the mouth, and the throat, goes down to the lungs. These are the lungs. So when your respiratory system is being attacked by coronavirus, COVID-19, so you would feel this. These are the symptoms. The symptoms, these symptoms sometimes are mild. So you don't feel that you're sick. You don't need to see a doctor. You would think this is just a normal flu that everybody has. But sometimes they are very severe. In any case, you have to isolate yourself. To isolate yourself means to stay away from people. To stay away from people, like to try to stay home. Most of the world now, people are staying home not to spread more disease to people who are healthy. So these are the very important vocabulary that we have to look at. There are more. If there's more, or if there's no vocabulary, I'll update you and try to make another short video. It's very important to protect yourself and to protect others. It's very important. So if, as I said, if you feel that you have any of this, you could approach a clinic or a hospital, or if you can't, you might call an emergency number. The paramedic or the ambulance would get you, and then you could be looked after and checked out. If you've been infected by coronavirus, then they will take care of you. If not, then that would be a regular flu. But still, you have to try your best to isolate yourself at home for at least 14 days. That's what we call quarantine. Quarantine is to be away from people if you have that disease. So again, in order to protect yourself and to protect others, if you yawn or if you sneeze or cough, try to be away from people when you're coughing, sneezing, or yawning. Do you know what is yawn? When you yawn, you make, oh, so you're yawning. still you have to be away. I just wanted to remind you, if you like my videos, subscribe or give me a thumb up and follow Learn English with Grayman. Always try to be away from others. If you have to go for shopping or any public places, at least leave 1.5 meters between you and the person who's next to you. Try to be away from people, because this is, you could catch the disease, you could be infected. Try your best to keep clean. What do I mean by keep clean? Make sure your hands are clean all the time. Make sure you have a sanitizer. If you don't have sanitizer, get a soap. Just regular soap, wash your hands in and out all round, very carefully. Wash your hands, that's really important. Try your best to avoid touching your face. And the norm in many countries, and I've seen that in North America and in Canada, most people do not touch their faces. If that's your habit, stop it. Don't touch any of the parts of your face. Don't touch your eyes, don't touch your nose, don't touch anything. If you have to, get a Kleenex and touch yourself carefully. And that will keep yourself healthy, you will not be infected. If you, again, washing your hands, again, make sure have a bath regularly. Make sure be away from people if you feel that you have any of the symptoms that I talked about. I wish all the best for everybody, and I hope no more people will catch this disease or to be infected. Follow my channel, Learn English with Grayman, and take care. Bye-bye.